Now that we have a good understanding of the different word parts of a medical term, and we have done some word building exercises, how do we actually define a medical term? Well, we always start at the end. We first define the suffix, and then we define the prefix, and then we define what comes after that, which is a word root or a series of word roots. Here's an example: prenatal. So instead of saying before birth pertaining to, we start with the suffix and say pertaining to before birth. For perirenal, instead of saying around the kidney pertaining to, we start with the suffix and say pertaining to around the kidney. So here's one without a prefix. Gaster means stomach and itis means inflammation. But do we say stomach inflammation? No, we say inflammation of the stomach. For mastectomy, we do not say breast surgical removal. It sounds just better to say surgical removal of the breast. How about if we don't have a prefix but we have multiple word roots? For example, gastroenterocolitis. Gastroenterocolitis. We have 3 word roots that mean stomach, small intestines, large intestines, and inflammation. So we define the suffix first. Inflammation, the first word root, the stomach, the intestines, and the colon. So gastroenterocolitis is inflammation of the stomach, the small intestine, and the colon or the large intestines. So we have our rules in defining a medical term, but sometimes we don't follow the rules because they don't make sense. So we define the term however it makes sense and if it is grammatically correct. So for example, post-hepatoplasty. If we follow the rules, it will be surgical repair after the liver. You know, suffix, prefix, then word root. That doesn't make sense. So we change it to, and the actual definition actually of post-hepatoplasty is after the surgical repair of the liver. Here's another one, dysuria. Following the rules, it should be urination that is painful. Well, that's also correct, but it also makes sense to just say painful urination. So sometimes a medical term is not exactly defined by the meanings of its word parts, just like the last few slides we did. The literal meaning is not the actual definition of the medical term. So here's an example, melanoma. The literal meaning is a tumor of black or a black tumor, but the medical definition really is melanoma is a skin cancer that begins in cells known as melanocytes. Here's another one, anemia. Literally, it means lack of blood, but then it doesn't really mean that someone who has anemia doesn't have blood at all. The medical definition of anemia is a decreased ability of the blood to carry oxygen. And then there's quadriplegia, which literally means paralysis of 4, but is that the actual meaning of this medical term? No. It's the paralysis that affects all of a person's limbs and body from the neck down. And here's a really good one, orthopedist. Specialist of straight foot, you know, is specialist, ortho straight, ped foot. No, the medical definition is a specialist focusing on injuries and diseases affecting the musculoskeletal system. So that's it. We follow our rules in defining the medical term, but make sure that our definition makes sense and that it is also grammatically correct.